Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. There are 3 different types of hepatitis, distinct diseases that affect the liver. Each type has different symptoms, causes, as well as treatments. Express Care's Dr. Jitka Lom joins us in studio now with the ABCs of hepatitis. Thanks, Doc, for coming in. So let's talk a little bit about hepatitis A first, since we're doing the ABCs, because there is hepatitis A, B, and C. So hepatitis A, I understand, is when the liver is inflamed.
Right, and actually hepatitis just means inflammation of the liver. And what you're talking about are the viral hepatitis, which now they actually go up to E, A, B, C, D, all the way up to E. Yeah, but the D and E are not very common in our part of the world. So A, B, and C. So back to viral hepatitis. Hepatitis A is disease that's transmitted through what we call the fecal-oral route. It's kind of gross, but you basically get it from people who didn't wash their hands very well and then handled the food that you ate. And so it comes in outbreaks. You can get it in third world countries, but even in North America and certainly Guam, you could get hepatitis A if there were an outbreak. Now, I haven't heard of any outbreaks here, which is good. But if you travel to, let's say, Thailand or Indonesia, places like that, they do have quite a lot of hepatitis A. But there's a vaccine that you could get to prevent that.
Okay, so what are some of the symptoms? Because based on what you're telling me how you get it, it would seem like it would be maybe you'd have food poisoning symptoms.
Yes, very much like that, exactly. Vomiting, diarrhea. One of the things with hepatitis, though, is that people will get jaundice. They'll get pain over here on their side, sometimes get a fever, and they'll turn yellow, and the whites of their eyes will even be yellow, and they'll be very weak and very tired. And we verify that they have that disease, hepatitis A, through a blood test. Everybody with hepatitis A recovers unless they're very, very frail. Hepatitis A is not generally a disease that kills anybody that's a healthy person, but it is, of course, very unpleasant, and recovery can be quite a few weeks before they're feeling well. So it's nice to prevent.
So if you get it, does that mean you always have it, or you get it and it goes away?
You're done. You get it once, and you clear it. Your body can handle it, and then you will never get it again. Except, of course, you might pass it to others if you're not aware. So that's the important thing about hepatitis A, is knowing that you have it so that you don't pass it on.
So you could be contagious then.
That's it.
And what's the period of being?
The period of time is a couple of weeks, and it of course depends a little bit person to person, but the viral shedding can be a couple of weeks, again through the feces on the hands. So whenever you're sick, wash your hands.
Definitely. All the time, right? Yes. All right, so let's talk a little bit about hepatitis B. What differentiates that?
So it's really a very different disease, because hepatitis B and also hepatitis C, these are transmitted through the blood and body fluids, meaning that you have to be in contact with somebody's secretions, their blood, their body fluids, semen, even rarely saliva. So that's how that's transmitted. Generally, hepatitis B is transmitted sexually or through blood transfusion in the past, not anymore, through contact with dirty, bloody dressings, or something like that. And the same with hepatitis C. Yeah.
Okay, so what are the symptoms of hepatitis B? How would you know?
Oh, hepatitis B is sometimes silent. Oh yeah, and I should have said one other way that you can get it is if you're a baby and you're passing through the mother's birthing tract, your mother has hepatitis B, you might get it. But of course, in our society, we're fortunate. People get screened for hepatitis B, and if they have it, their babies are safe. And different treatments to prevent transmission. But in other countries, that happens. So the symptoms can be very silent. It's not usually as dramatic of a disease as hepatitis A. It can just be a mild, unwell feeling, a little bit like a flu. And then later on in life, it's discovered through a blood test that the person had hepatitis B or hepatitis C. And right now in the media, there's a lot about hepatitis C because it's sort of like a silent epidemic. There's many, many people that don't know that they have it. And they're carriers. Their liver is still being damaged by it, but they're not aware of it. And sometimes they can also be passing it to other people if they're not aware of it. The really severe consequence of hepatitis B and C is liver cancer or cirrhosis, which is, of course, complete destruction of the liver and liver failure. So those are the two really bad things that can happen with hepatitis B and C. Thankfully, though, even if you did get hepatitis B or C, most people don't end up in that category because their immune system is strong enough to continually battle those two viruses.
And so what would be the treatment?
Oh, well, hepatitis B and C do have treatment, which is a blessing. There's an antiviral therapy called interferon, and there's other ones that are out there as well, Epivir and these other newer drugs. And so somebody typically with hepatitis B or C will go through about a 6-month course of a drug called interferon, which is very unpleasant for them. It's kind of like chemo. They feel sick and tired and so on. But at the end of that, they have a very good chance of reducing their what we call viral load, meaning that they are basically in control of their disease again. It's not always cured, but it's controlled that way. And they can do a second round of that if necessary. And sometimes people are on long-term suppressive medication as well to try to keep the virus down. So the main thing is to identify the disease. If you have it, then you can take treatment.
And that's through a blood test, as you mentioned.
Yes.
All right, well, we've got to take a quick break, Doc. Thank you for all that information. We will pick up our discussion on the ABCs of hepatitis when Healthy Living returns. Stay with us.